there again. This is Master Trainer Brad Glaser. We're going to go over the NASM OPT model. I primarily use NASM in my personal training clients. I've been doing it for over 20 years. And I've seen a huge success in progressions, regressions, and rehabbing clients and getting them from point A to point B as quickly as possible. I use the NASM OPT model, and I'm going to explain to you what that is. It looks like a triangle like this. And there's three major phases in here. We have power training, we have strength training, and then we have stability training. Now the reason why these phases were created is to take you, a client, into regressions and progressions. Every 3 to 4 weeks your body plateaus out, typically on a workout, and you need to switch the modality of what you're actually doing. And that switch is what this OPT training phase is all about. The first phase of training is corrective exercise training. Second is integrated stabilization training. Third phase is strength endurance training. Fourth phase is muscular development training. Fifth phase is maximal strength training. Sixth phase is elastic equivalent training. And the seventh phase is maximum power training. Each 3 to 4 weeks, you cycle through every single phase, and what this does is it helps you overcome plateaus, and it's more of a natural progression on getting your body more functional. So usually what we start off with is corrective exercise training. What we're trying to do is kind of really figure out where your body is right now and where it needs to be based off your muscle imbalances. And there are at every single kinetic checkpoint in your body, meaning your ankles, knees, hips, shoulders, lower back, spine, neck. Any of those joints can have a muscle imbalance. All a muscle imbalance means is one muscle's tight, the opposing muscle is possibly weak or overly stretched. And what happens with that is your body or posture will conform to that. So for example, if my chest is really tight and my rhomboids or my upper back is really weak, what'll happen naturally to me is I'll start slouching and my shoulders will roll forward like this. Vice versa, an anterior pelvic tilt, if my erector spinae and my lower back's tight and my hip flexors are tight, naturally my abs and my glutes are going to be weak. So what's going to happen is I'm going to get an anterior pelvic tilt, meaning I'm going to arch my lower back. And having any muscle imbalance puts your body in extreme stress on for example, your joints. It increases your chance of injury and joint pain. So what I want to discuss now is how do we find muscle imbalances in your body. Now what I usually do is a overhead squat assessment, and it's really simple. You look at yourself in the mirror, or I'll look at a client, and I will have them face on a frontal plane of motion, arms above the head, and I'm going to have them squat down as low as they can comfortably and come right back up. And what I'm looking for is all their kinetic checkpoints again, their neck, their shoulders, their hips, their knees, and their ankles. Same thing, sagittal point of view, and then frontal plane of view, just walking around. Now, ideally, your knees and ankles should be straight like they're on train tracks as you squat down. So, see me, but on the frontal plane of view, your head is not forward, it's back and neutral. Your shoulders, your arms are not falling down, and you don't have a huge anterior pelvic tilt as you squat down. Also, if your feet flatten or they roll in. All those are considered muscle imbalances, and any one of those muscle imbalances can cause some form of injury. So for example, so a common muscle imbalance someone can have is a forward head syndrome. And all that means is that your cervical spine is forward more than it needs to be. And it tends to happen with people who sit at work all day in front of a computer, for example. They're always looking forward or looking down. And what happens is your sternocleidomastoids get really, really tight, and they end up pulling your head forward. The muscles that are weak are the exact opposite, is your deep cervical flexors in your neck. Also, medium lower traps will help pull your head back and shoulders back and down. So the muscles that are tight are sternocleidomastoids in the front of the neck. The muscles that are possibly weak are deep cervical flexors. And the possible injuries that can occur from that is you can have neck pain, you can have headaches, migraines, anything like that. Here. So, and that's not only every single day you might get those possible issues, but imagine working out, and many people do this, is when they push heavy weight or they squat, they throw their head forward over and over and over again. And all you're doing is really teaching your body to replicate that movement pattern every single time you do that repetition. And what happens over time is that you train those muscles with muscle memory to throw your head forward. And the problem with that is that you're going to increase your the degree of your head going forward, and also to increase your muscle imbalances to the point where you'll have some form of pain or injury. And we want to try to stay away from that. I've been training for over 20 years. I've been doing physical therapy through NASM in the sense of a corrective exercise specialist. I'm also certified through PFIT, which is also a rehab clinic in Texas. And so I've been doing this a while, and I've pretty much rehabbed almost every single joint from my career of training clients. And time and time again, 99% of the time, it's your muscle imbalances that cause most mobility issues and or joint pain and or injuries, all three. All right, so we got the forward head syndrome down. Next, let's talk about another common muscle imbalance which most people have is forward shoulders. All right, so forward shoulders tends to happen is caused by your chest being very tight, anterior deltoids being pretty tight, maybe a cocobrachialis. All those muscles are so tight they cause your shoulders to roll forward. So we'll write that down. Also your lats. Your lats are located right here. Possibly your anterior deltoid. That's tight. I don't know why I keep erasing that, but I should keep it up. Alright, so the muscles that are weak are the antagonists, or all the opposing muscles of the muscles that are tight. And it's quite simple. Your rhomboids, medium lower traps, posterior deltoid, external rotator cuff, infraspinatus, teres minor. All the muscles that help pull the shoulder blades back and down are slightly weaker, possibly weaker. So your rhomboids, medium lower traps, posterior deltoid, and external rotator cuff. Now, the possible injuries that can occur from this. You're looking at possible, because whenever your shoulders roll forward, it puts a lot of stress on your traps, and your traps end up getting really tight. You can obviously get headaches again. Spell headaches. Bicep tendonitis. Shoulder injuries. So very common to tear your rotator cuff. Just because your subscapularis, for example, with forward shoulders tends to be very, very tight. And if you hyperextend one way or the other, you can actually pull your rotator cuff and tear it. And it's not a very fun injury. It depends on how severe the tear, but it could take you a couple weeks to 6 months to fix. So it's not very fun at All right, so that one is forward shoulders, and I can show you here. Your pecs tight, anterior deltoids tight. Rhomboids, medium lower traps are weak. Now what happens is it causes your shoulders to roll forward, and when these muscle imbalances is considered your posture too. So it's not like what you do every single day. This is where your body, your movement patterns are. Now the problem with that is when you work out, and for example, you're doing like a squat or a bench press, or even trying to do rows, what you're going to notice is that you're going to mimic those movement patterns based off your muscle imbalances. So if you're trying to do a row, but your chest is really tight, it's going to be really hard for you to get your shoulders back a little bit to activate the rhomboids. And what ends up happening is that muscle imbalance becomes it's called a cumulative injury cycle, which I'll explain in a second. And the cumulative injury cycle, what that means is one muscle imbalance causes another muscle imbalance, until something gets injured. And then when you get injured, you create a altered neuromuscular control, which then causes another muscle imbalance. So it just becomes more like a domino effect. I'll explain that after we go through the rest of your muscle imbalances. You can read that. All right. So we got forward shoulders here. Next muscle imbalance is quite common is anterior pelvic tilt. Anterior pelvic tilt. All right, so the common muscles that are tight when you're anterior pelvic tilt is your hip flexors and your erector spinae. Hip flexors are right here in the front, and as the name says, they hip flex your hip. Erector spinae is exactly the Latin word of erecting your spine. So that's what the erector spinae does, is it forces your spine to erect, and the hip flexors flex your hip. So you can imagine what this posture is a lot. People who sit all day, people who are sedentary. I've seen runners obviously have very tight hip flexors because they use them to propel themselves forward, and they also have a huge anterior pelvic tilt. Okay, so tight hip flexors, erector spinae. What's weak? Core, 26 muscles surround your lower lumbar spine, rectus abdominis, transverse abdominis, obliques are weak, and also the glutes. Glutes are a huge stabilizer of the hips. Also, they help with giving you more of a posterior pelvic tilt. So, what's tight? Hip flexors, lower back. What's weak? Your core and your glutes. Now, with this muscle imbalance, again, what happens is you arch the lower back a lot. And what injuries can occur? Low back pain. And possibly pulling back. Pulling your lower back, hip impingements is another one. And if you have any of these injuries or pains right now, it's possible that you have anterior pelvic tilt. And the way to correct that, as I said before, there's a whole physical therapy program to correct that, which I have in my app, which is going to be free for everyone. What we need to do is we need to loosen the tight muscles, strengthen the weak muscles, and integrate that in your exercises that you do with proper form to correct movement patterns. And eventually, over time, through repetition, your body will fix itself. And most pains or injuries, again, come from muscle imbalances, unless you have a bone and disc issue from an accident or something genetic or hereditary or something like that. But from my experience, 99% of the time, most pain comes from having muscle imbalances. All right, next. Why did I erase that? Put that back. Okay, next muscle imbalance that I've noticed and see is knees rolling inward. So when you're squatting, your knees adduct like so, turn inward like this. And knees adduct. Alright, so for knees adduction, it's really simple. Your adductors are really tight. That's what they do. Your inner thighs, they're responsible for turning your knees inward and stabilizing the hip. Possible hip flexors too. Muscles that are weak, your glutes and your abductors. So the exact opposite of your adductors. AB abductors is opening the knees, for example, or abducting. And then your adductors is the exact opposite, is closing. So the muscles that are weak are your glutes. Primarily, it's mainly your glutes, possibly your IT bands. It's not really a muscle, it's more a giant band of fascia and tendon. And injuries that can occur from that is knee pain. Lots of knee pain. Jumper's knee. And or you can also pull your groin too from it being too tight. So groin injuries. So now the exact opposite of that, as you would find out, is when people have bow-legged, or the knees when they turn out, more so than being neutral. So we'll say knees abduct now, and you guessed it, it'll be almost the exact opposite of that. So what's tight here is could be your piriformis. Your piriformis is a small little muscle that in your glute, and it's responsible for stabilizing the femur. Also, external rotation of the femur also. Muscles that are weak is the opposite, but glutes and adductors. Sorry about my handwriting. I know it sucks. I don't usually write. Okay. And injuries occur. Knee pain, groin pain too. You can pull your groin just from abducting too much. Injuries are pretty similar. So that is another muscle imbalance that you can have. All right, next, let's do your feet externally rotating. So feet turning outward. So you probably see people, or you might do this yourself, how your feet turn out when you walk or when you squat, anything like that. The neutral position for your ankles is straightforward, like you're on skis. If they're externally rotated, it shortens your calves, your lateral gastroc, and what happens is, as one muscle is shortened, it lengthens the opposite, which is your anterior tibialis. And what ends up happening is your ankles roll out, and then they start rolling inward, which then lengthens the anterior tibialis, so you're more prone to rolling your ankle and shin splints. A lot of pain. Well, let's write it down. So lateral gastroc's tight. Lateral gastrocnemius, which is your calf, the outside of your calf. What's weak? Your anterior tibialis. Anterior tibialis is right here, right in the front of the shin. Posterior tibialis probably also. So we'll put posterior too. Injuries can occur from that. You can roll your ankle. You can get shin splints. And the one that a lot of people get is plantar fasciitis. So now these injuries doesn't necessarily mean you have them now. All it means is you're more prone to get them in the future. And especially if you're working out, for example, as I was explaining before, if you're working out and you have all these muscle imbalances already, and then you're adding, for example, a squat, you're adding 100 pounds, 200 pounds, 300 pounds, squatting down, and your body's movement patterns are still functioning in this way, what ends up happening is you're putting extreme pressure on a joint that is not in a neutral position. You end up wearing your cartilage down in that specific joint, and you replicate that bad movement pattern to the point where you're most likely going to injure yourself in the future. And again, it won't happen tomorrow, but it could happen down the road. You keep reiterating bad movement patterns, you keep reiterating bad posture, the bad posture is going to come back to get you eventually, and you're just more prone to some form of injury.